Good afternoon, everyone. We'd like to welcome you to our Next Generation NYCHA webinar on a special topic, Smoke-Free NYCHA. Today's webinar is an opportunity for NYCHA residents and partners to learn more about the implementation, process, and policy for Smoke-Free NYCHA. We'd like to thank so many of you guys for taking the time out of a busy summer day to listen to us and discuss this important initiative. We have two of us who've been working, collaborating on this work for the past 18 months who are going to be presenting to you. I am Marvin Jean-Jacques, the Program Manager with Health Initiatives with the New York City Housing Authority. I work in NYCHA's Health Initiatives Department, and what we do is we manage partnerships and lead interagency efforts to connect residents to preventative health resources, create healthier indoor environments, and cultivate resident leadership in health.
Good afternoon, everyone. My name is Elizabeth Hamby. I'm the Acting Director of Health Equity in All Policies at the Center for Health Equity at the New York City Department of Health and Mental Hygiene. The mission of the Center for Health Equity is to strengthen and amplify the health department's work to eliminate health inequities which are rooted in historical and contemporary injustices and discrimination, including racism. And we work very closely with NYCHA's Health Initiatives team through a number of different avenues and are really excited to talk about some of the connections between smoking and health, and also how community partnerships are really a part of building healthy communities.
So with so many things going on, people ask us, why is NYCHA now implementing a smoke-free policy? The first part of this answer is that this is a HUD requirement. The federal government is asking that every PHA, public housing authority, in the country to go smoke-free, and this began in February 2017. So we've had 18 months to implement this policy, and HUD expressed in the beginning their rationale for this ruling. HUD said that smoke-free public housing policies would improve indoor air quality, benefit the health of public housing residents and staff, reduce the risk of fires, and lower overall maintenance costs.
So from a health perspective, we want to be very clear that there is really no safe level of exposure to secondhand smoke. Secondhand smoke can increase the risk of asthma attacks, respiratory illness, stroke, heart disease, and lung cancer in non-smoking adults and children. And I think it's really important to say here that children and seniors make up nearly half of all NYCHA residents, and they're often the ones who are the most impacted by secondhand smoke. We know that communities of color are often disproportionately impacted by secondhand smoke, and that's really, not fair. We also know, according to a 2012 survey that the health department conducted, that over 70% of NYCHA residents would prefer to live in a smoke-free building. We've also heard that many residents report smelling smoke entering their home from outside their apartments. The health department is currently working with some of our other evaluation partners to replicate that survey, and we look forward to reporting back on what we learn.
So in response to the HUD mandate, we created this initiative called Smoke-Free NYCHA with the goal of creating healthier homes for our public housing residents and healthier working environments for employees. The way we began to approach this was to have broad engagement of residents, staff, and partners, and we made sure to remain grounded in the expectation that this change is going to be gradual. This change is an important component to healthy and sustainable housing. Now, Smoke-Free NYCHA isn't our only or even our most critical healthy homes priority, but it's part of a commitment to promote healthy housing, and this was expressed in the Next Generation NYCHA Sustainability Agenda. Now, the policy takes effect July 30th, 2018. What the policy says is that NYCHA will prohibit smoking of tobacco products inside public housing units and apartments, inside all indoor common areas, that's the lobbies, the stairwells, the hallways, and within a 25-foot perimeter of public housing buildings, those residential or administrative buildings. Smoking in these areas would be a violation of the public housing lease, and the prohibited tobacco products are any items that involve the ignition or the lighting of or burning of a tobacco leaf, right? So this does not include or apply to electronic cigarettes. With regard to the lease, we did send out lease addendums. They went to every head of household. The planned lease change notice was put up in every building beginning in January of 2018, and residents were able to return the leases to us through a lease addendum that came in person through the property management office, electronically, or by mail. Now, because this is in the lease, there's a graduated enforcement process to make sure that if the lease is violated, we're able to show that there's enforcement. And so what this looks like, and many people have asked us, is staff and residents are both able to report a violation of this policy. Property management staff will then begin an informal resolution process after they've received one documented observation by a NYCHA employee or 3 recorded resident complaints to the property management office or to the customer contact center, the CCC. During the informal resolution meeting, staff will provide educational materials and discuss the violation of the policy. Property management will then initiate the formal resolution process if a household doesn't respond to the informal resolution meeting, or one of the residents, guests, or visitors violates the smoke-free policy after the informal resolution meeting. So this is a matter of having escalated warnings. It's specific, progressive enforcement so that we could remedy the matter of failing to comply to the rule. But what we also want to do is make sure that people have the resources and the opportunities to comply to the rule or receive cessation support so they could quit if they choose to. Now, enforcement, though a critical part, isn't the major part of Smoke-Free NYCHA. We did a lot of work with regard to engaging with residents and partners, and Liz is going to speak to that work.
Thanks, Marvin. So, as you've been listening to all this information and hearing about the work to date, you're probably noticing something that we've really grappled with. How do you implement a policy at this scale in such a short period of time? So through the partnership between the health department and NYCHA's health initiatives team, we knew that we had to go out and engage residents to get their ideas, collect their feedback, and really incorporate that into every aspect of our work. So in 2017, as soon as the rule was announced, we set out to have 9 community meetings on smoking and health. These meetings took place in each borough and brought together about 352 resident ideas. We also facilitated activities at 54 family days and put together an advisory group on smoking and health. So through those engagements, we got to hear a lot about NYCHA residents' stories with tobacco. Just about everyone that we spoke to had a story that they wanted to share about how they, a family member, or someone close to them had been impacted by tobacco smoking. We also got to hear about some of their priorities. So you can see here from our scale, when we asked residents what was most important to them about implementing Smoke-Free NYCHA, the number one thing that they said was education. Make sure that everybody knows what the rule is, what's covered, what enforcement means, and also, how they can access resources to help them quit smoking. Providing those resources and making sure that people who are trying to quit smoking are supported was the second highest priority that we heard. And also really making sure that there were very clear consequences that were established for people who break the rules.
As a result of our work in 2017 and that engagement, we now had concrete ideas about implementation and were able to take the ideas we got from residents and bring them to residents through our Smoke-Free NYCHA community conversations. So we did this throughout all of the NYCHA developments. Through every borough, we had these meetings, had residents come out and engaged in conversations around secondhand smoke exposure and the policy. We also had smoking cessation groups, and we plan to continue these groups where people who were interested in quitting smoking could come in and learn about cessation and cessation support. And we created a program, an apprenticeship program with our partners, Green City Force, who employ NYCHA residents ages 18 to 24 to become an outreach team to go out to developments door to door and contact residents on behalf of this initiative. We did a Facebook Live event, which many of you guys probably participated in, and we had a youth video project courtesy of NYC Smoke-Free, and we had our youth leadership councils involved to not only speak about Smoke-Free NYCHA, but even learn video editing and how to interview people about public health initiatives. And now we're doing a training with the Summer Youth Employment groups to train 900 NYCHA residents, all ages 14 to 15 years of age, to advocate for smoke-free housing and learn about this initiative. To date, in total, we've reached over 20,000 residents and plan to continue engaging residents about this initiative.
Something that we knew was really important in 2018 was creating space for residents to talk to each other about going smoke-free. So one of the strategies that we used in our 2018 community meetings was a simple activity that we used to help folks talk about these three big questions that you see on the slides here. So what does community mean to you? Who is responsible for the health of your community? And finally, what can residents do to help their neighbors take smoking outside? We heard from residents around the city that they, really felt that health was the responsibility of everyone in the community, and heard all kinds of incredible ideas, from just having a simple conversation with a neighbor who's smoking, all the way up to organizing activities like walking groups or gardening groups that can help people who are trying to quit take on other activities instead of smoking. So another kind of really important way that we developed our strategies around Smoke-Free NYCHA was with the support of the Advisory Group on Smoking and Health. The advisory group was convened in 2017, and this group, who was made up of a combination of NYCHA residents and partners from organizations like the American Cancer Society, partners in the healthcare system like Mount Sinai and NYU Langone, folks from academic institutions like the Mailman School of Public Health, as well as the Office of Councilmember Donovan Richards, staff from the New York City Health Department, and advocates from NYC Smoke-Free and Tobacco-Free Staten Island. And this group of folks really helped us, drill down into the feedback that we heard through a series of critical deep dives around everything from education, how to help people quit, and enforcement. And just a quick note, we're really proud that two of the NYCHA resident members of the advisory group were able to join NYCHA and the New York State Health Department at a national conference in Atlanta, Georgia in September 2017. So the advisory group put together a report of guiding principles for implementation of Smoke-Free NYCHA. You'll see that coming out publicly in the coming days. But, as you can see from this slide, the group really did establish a vision for what Smoke-Free NYCHA should be. They told us that we should make sure that implementing Smoke-Free NYCHA is really grounded in a long-term commitment to improving the health health of NYCHA residents, which is negatively impacted by secondhand smoke, and other factors. They also said that we should make sure that implementation is transparent, accountable, and inclusive of residents' feedback and guidance. They told us that implementation should be leveraged to support NYCHA resident engagement and increase leadership. And finally, they said, implementation has to be responsive to the needs and priorities of different communities and developments. It's definitely not a one-size-fits-all.
So we made a point to create an opportunity for youth to be involved, to champion this, and we activated youth messengers. So what you see here in these photos are some of our youth messengers. So that group I had mentioned, Green City Force, came in and we did some trainings around health equity, around smoke-free and tobacco legislation, etc. And so they learned to be experts around this and would go to the communities to speak not just as residents, but also as public health workers and advocates. And who you see in the center there in the top, that's Asha and Portia, and they worked with us for a period of 3 months, day to day, coming out to talk to residents about Smoke-Free NYCHA, and had a unique perspective, having already graduated from the program of Green City Force. And below you see some of the activities. So the priorities, we did receive some information from residents at community meetings, but we wanted to go to the developments and find out what residents were prioritizing. And we see the leader of one of our Brownsville Youth Leadership Council, Zachary Rumnett, at the top right, and his brother in that same column on the bottom right. And they were featured in the video, which you could find on our website. And this is a 17-minute documentary that documents what we did on behalf of Smoke-Free NYCHA. Now, engaging the youth is important. We also had some targeted engagement to seniors through our senior surveys, working with our resident engagement department. But there's also a group that we had to make sure to train, which was our employees. Actually, 25% of our residents are also employees. And this intersection, we wanted to make sure to contact with programs like the Escape program, which allows staff to get cessation support for free if they're a city employee. We also trained 500 plus property management leaders around the policy, why we're doing Smoke-Free NYCHA, how they could get involved, and how they can support it. And this summer, we're training all of the property managers, assistant managers, superintendents, and housing assistants around Smoke-Free NYCHA.
So just to highlight some of the resources that are out there to help folks who are trying to quit smoking, you'll see coming up on the right hand of the screen, folks may have seen these palm cards that were created, just letting folks know about Smoke-Free NYCHA, as well as some of the resources that are available to people who want to quit. First and foremost, the best way to get help with quitting smoking is by talking to your doctor. There are lots of resources through health insurance, including Medicaid, which cover the services to help you quit. You can also get a starter kit of quit smoking medications, or you can talk to a quit coach by visiting nysmokefree.com or calling 1-866-NY-QUITS or calling 311. And so that's the New York State Quit line that can connect you to some of those resources. On the nyc.gov website, you can always search for NYC Quits to access the latest information there. And finally, we want to make sure that everybody knows about the new Help Me Quit app, which is a free app available in the Apple and Android app stores, which includes all kinds of tips, activities, encouragements, and a community to really help folks who are ready to go smoke-free themselves.
So we're glad to have been able to talk to you guys about what we've done. But what's next for Smoke-Free NYCHA? We're focusing on training the Summer Youth Employment Program participants, these 900 young people who can now speak about Smoke-Free NYCHA. Continue with the staff training we mentioned. The policy will take effect July 30th, 2018. To reinforce this policy, we'll have new signage put up on the buildings and within the lobbies, and activating our resident navigators and ambassadors around this particular initiative. We have a lot of residents we've heard of who are excited to have Smoke-Free NYCHA come and want to support this at their development. So stay connected to the webpage for updates. You could go on nyc.gov/Smoke-Free NYCHA, and you'll find out more information about this initiative. All right, well, we'd like to thank you all for your participation. We had some really good questions. The webinar is going to be recorded and it's going to be put online, and we're going to have some final words from Elizabeth.
Thanks, everybody. You know, this is such an important conversation and such a really incredible opportunity for NYCHA residents, staff, and everybody who cares about them to really come together and make a big change that we know for a fact will positively impact the health of residents. Thanks.